today we are very happy to have two speakers with us, Dr. Lam Chak Matthew from Hong Kong and also Dr. Capucha from Israel. They are both the winners of the last Face Ahead. In Face Ahead, we have an award called the Young Surgeons Award. So if you are submitting an abstract, if you choose to be a competitor. So we will go through a very rigorous process of choosing, shortlisting abstracts, and then we'll ask you to submit a video, and then in the end we'll pick the top six to present on stage in Face Ahead. And then for Matthew and Tao, Tao was the first, and Matthew is the third of the Young Surgeons Award, and they have presented an excellent studies of their own, and they will be sharing with you of their studies, and then also we'll have some time to talk about their experiences.
Yeah, and Mike, I want to just highlight that this event is targeting and it's structured towards all our young, enthusiastic surgeons, the new generation. And I'm encouraging every one of you to submit their abstracts and share in this competition. And I'm looking forward also for like great ideas, great research to be submitted, and that would be like the highlight of the upcoming Face Ahead in Bangkok.
Thanks. Without further ado, maybe I invite Matthew. Will you please share your slides?
Okay, so good evening, everyone. Hello, fellow professors, colleagues. I'm Matthew from the Oromaxillofacial Surgery Department, University of Hong Kong. It's my great honor to be invited to join this sharing session, and it is indeed my greatest pleasure to be able to present to you my project titled The Use of Locally Applied Carboxylated Erythropoietin. We call it CEPO in the later presentation, in promoting nerve healing upon crush injury, which was presented in the 2024 Prague Face Ahead conference. So nerve injury, it's known complications to all surgeons in oral surgery as well. That may lead to facial numbness, taste alteration, pain, or even depression. As we might all have encountered, neurosensory deficits is one of the common surgery nightmares that's very challenging for both surgeons and patients to get along. Treatment modalities are usually very limited. Outcomes of conventional treatments like neurography, neurolysis, and conduits are highly unpredictable. So among all the therapeutic options for neuroregeneration, erythropoietin, EPO, is one of the most popular choices that's backed up with a lot of research and evidence. It's proved to be neuroprotective. However, it's also a labeled drug for treating disease such as anemia, for boosting the productions of erythropoietin. So as a hormonal drug, it's also giving us hematopoietic side effects that's causing homeostatic disturbance, and research also found it to be increasing risks of systemic disease such as myocardial infarctions and stroke, making it not an ideal subject to be implemented as a routine therapeutic agents for treating neurosensory deficits. So to overcome these drawbacks, carboxylated erythropoietin is a homologue of EPO, which is the subject of the study, retain the functional purpose of the neuroprotection while omitting the unwanted hematopoietic side effects. Yep. So the knowledge gaps lies in that it's currently very, very scarce evidence on the impact of CPO on Schwann cells, which is renowned in playing an essential role in mediating peripheral nerve injury and neuroregeneration, and there is no evidence on showing how the impact of CPO on Schwann cells may revolutionize the orchestration of all the complicated physiological events during peripheral nerve injury healing. In my project, the objective is to investigate the physiological and histological outcomes of nerve injury in vivo and upon the effect of localized delivery of CPO. So my project to start with, The first and foremost is that we need to synthesize CPO ourselves, as there is currently no commercially available products of CPO that can be readily to buy. So we have to synthesize it ourselves. I started from reacting recombinant EPO with sodium borate, potassium cyanide, and followed by dialysis purification for more than 24 hours. And it can then be freeze-dried for storage under -20 degrees and stored for future use. It is characterized by electrophoresis, which the results will be shown to you in later slides. The next step comes the animal surgery, where adult Sprague-Dawley rats of around 10 to 18 weeks were used. Their sciatic nerves were exposed and crushed with Spencer-Wells forceps, and the CPO was delivered locally with fibrin glue onto the crushed site. They are allowed 21 days of healing, and the rat would then be put on the digigate, and the sciatic functional index was assessed as a physiological assessment. After that, they will be sacrificed, and the sciatic nerve will be harvested for histological analysis by immunocytochemical staining. And here comes the result. On this gel electrophoresis, it is used to characterize the product of CPO. On lane 2, you can show that there is a wide band of around 34 kilodalton, which is loaded by unreacted erythropoietin, while lane 3 shows that the erythropoietin was digested by endoproteinase dalton. Lane 4 shows CEPO, the product, and lane 5 shows that CEPO was resisting the enzymatic digestions due to the chemical structural changes, indicating that successful synthesis of CEPO. After 21 days of healing, the rats was put on the digigate, which is a walking tract, and sciatic functional index was calculated as shown by these figures. It is using an algorithm by comparing the toe spread and the size of the pores on the experimental size and the control sides to calculate by this formula as an index to show the healing conditions upon sciatic nerve injury. It is an index that ranges from 0 to -100, while 0 indicates an injured conditions, and -100 indicate full compromised function. So this bar chart shows that CPO group has a significantly higher sciatic functional index than the control group, which is comprised with only application of fibrin glue, indicating a better functional recovery.